and Vanakkam. I hope everyone is safe by being inside the house in this pandemic situation. This is the situation where you cannot come to the hospital for minor ailments. So to avoid that situation, I plan to give advices and remedies for some of the orthopedic issues which you can take treatment in the home itself. I've seen most of the elderly patients, they come with the pain and stiffness in the shoulder and difficulty in combing the hairs and difficulty in taking the shoulder above the head and difficulty in wearing the cloths and removing the cloths. So what we call it, this kind of situation is a frozen shoulder. That means our shoulder is free of all movements, which is associated with pain. Especially our shoulder joint, what we call it as ball and socket joint. If you keep this as a socket, this is a ball. It will be like that. That ball will roll inside the socket. So this is the ball and socket joint. Usually the shoulder joint is covered by capsule, that is the thin layer of this thing is called it as capsule, that will be covered over the entire shoulder joint and also by the ligaments and various muscles. So what will happen in the frozen shoulder is, due to chronic minor trauma and also especially arthritic changes, that capsule become adherent with each other, and that will prevent the ball to move around, and that will also produce pain inside the shoulder joint. This is what will happen in the frozen shoulder. Especially diabetic patients are more prone for this kind of situation. So what can be done to relieve pain and stiffness for this kind of shoulder problem is, main treatment is mobilization exercises. That is the first treatment method to relieve these capsular adhesions, so that you will get rid of the pain and stiffness in the shoulder. There are set of exercises are there. One exercise is, you can take a towel, whatever towel you are having inside the house, you can take that and keep the towel in your back like this, and you can, as if you are coming out of the bathroom and you are cleaning your back like that, you can do this kind of movements like that. You can change. And also keep the towel as if in the previous age group, when I was a kid, I saw that my mother and grandmother were used to do that தயிர் கடையிறதுன்னு சொல்லுவாங்க. These kind of movements you can do it with the towel also. And also there is another method of treatment is, you have to stare with one point, don't shift your head here and there like that, and take your hand and this arm should touch the one side of the ear and head, and you are trying to touch the opposite ear with your hand like this. Initially it will not come, you have to keep doing and keep practicing, it will automatically relieve the stiffness. These kind of exercises. Another set of exercises is pendulum exercises. What is pendulum is, by hanging your shoulder like that, and you have to rotate in that and clockwise as well as anti-clockwise. This is also another method of treatment. You can do it in your home itself. But before doing this, start doing these exercises, better give hot water fermentation for 5 to 10 minutes And once you finish the exercises, you can give cold water fermentation to relieve the pain. Initially, when you start doing the exercises, the pain will be there, but once you start, even with the pain, you can take, to relieve the pain, you can take the painkillers also. Take the painkiller and start doing the exercises. Once you keep doing the exercises, then that range of motion, that means the shoulder range of motion, automatically will improve. If it is improving, then you can keep doing the exercises. Then that stiffness and that capsular adhesions, what I told you previously, will get rid of, and then you will get rid of the pain and everything. So initially you can start doing these kind of physiotherapy exercises, and if you want, you can take some analgesics to reduce the pain, but don't take the analgesics for too long without doctor prescription. This is the initial method of treatment. Those who have a minor and moderate range of motion problem in the shoulder, they will definitely get benefited with this kind of exercises alone. So take the painkiller if you want, and give hot water fermentation before start doing the exercises, and do the exercises. That exercises should be regular, and also if you want, you can slowly improve the number of times you are doing that exercises, so that will you can relieve that problem very early. And after that, once you finish the exercises, give a cold water fermentation. And if you are a diabetic, reduce your glycemic index. So this is the main method of treating the shoulder stiffness and pain, what we call it as frozen shoulder. If you are having severe kind of frozen shoulder, that means even you cannot able to lift up to 45 degree, then consult an orthopedic surgeon, and they will give some other kind of management to relieve your problem. I hope this will be helpful for your home remedy for the treatment of this kind of problem. Thank you so much.